In Singapore, there are almost 4,000 hemodialysis patients. Madam Honey is 47 years old. She has been diagnosed with chronic kidney failure for 5 years and has been undergoing hemodialysis. As the sole breadwinner at home since her husband passed away 10 years ago, she has to take care of her 2 children and cope with her disease. Let us take a look at her story.
Wait, Ma. Wait, dialysis, right?
Yeah?
Forgot this, your IC.
Oh, okay.
Remember this, okay? Call us when you're coming back.
Okay, bye.
Hi, good afternoon. I'm staff nurse Sarvesh. How are you feeling today?
Hi, I'm feeling quite good today.
Okay, can I have your full name and IC number, please?
You can call me Madam Honey, but
Okay.
let me give you my IC.
Thank you. Okay. So, Madam Honey, see you're here for your dialysis session.
Yeah.
You're looking pretty good. I see you're taking good care of yourself.
Yeah. Are you a new staff here?
Yeah, new here actually.
Because I have been here for quite a few years,
Okay.
and I haven't been this well all along.
Oh,
Yeah.
what do you mean?
Like initially, I got quite a lot of complications here and there, but I've learned to take better care of myself. So I think, yeah, today I'm feeling quite alright.
Okay, can you tell me more about what happened in the past?
Yeah, sure. Like many years ago.
Hi, Madam Honey, I see you've already changed ready for discharge. But first you have to go for a dialysis session. You're aware of that, right?
Yeah, but what is dialysis?
Yeah, okay, that's what I'm going to actually be explaining to you. I'm actually a dialysis nurse, so I'll explain to you a bit more about your condition and what dialysis is about, so that you know what you're getting yourself into. Alright?
Okay.
So, Madam Honey, I'm going to explain to you more about the urinary system.
So what happens is the blood from the heart gets pumped into both our kidneys. The kidneys then filter out the waste products. These waste products then flow by the ureter and get stored in the bladder. It will be stored there for a while and then excreted as urine. From this we can actually understand how important both our kidneys actually are. For your condition, your kidneys aren't working too well unfortunately, so they are not filtering out the waste products well enough. Now let's zoom in on the kidney in particular. So what happens is the blood will come to the renal artery from the heart and into the kidney. It then gets filtered within the kidney itself, and the waste products will flow through the ureter and into the bladder, as we have seen in the previous slide. Okay, now I'm going to explain to you more about what is chronic kidney disease. CKD is mainly caused by 2 conditions. One is diabetes and the other is hypertension. I understand you've been suffering from hypertension for the last couple of years.
Yeah,
You're also on hypertensive medication as well, right?
yeah,
Okay, so what happens in CKD is that your kidneys will slowly start to lose their function. This is unfortunately irreversible. It will only keep on getting worse. And when your kidney function actually gets less than 50%, we will consider it end-stage renal failure. Fortunately, your condition is not that severe yet, but dialysis is still very important for you. So now we will look at the warning signs for CKD. Can you identify any of these symptoms?
I think I got change in urine pattern, like different color, sometimes a bit of blood, although I'm not having mental. Then yeah, very easy short of breath. Then tired all the time. My back also pain when I walk, especially.
We actually have a couple of treatment methods for CKD. Currently for you, we're looking at dialysis, and your doctor might also prescribe certain medications like ACE inhibitors. You will probably need to make some changes to your diet as well. For example, you could try to lower down your protein intake by reducing the amount of red meat that you consume. There are certain medications that you should also avoid, such as decongestants and vitamin supplements as shown here in this list. I understand you're a smoker as well, right? We would probably need to look into slowing that down as well, because smoking is actually a very important risk factor for CKD, and Well, continued smoking is going to make your condition worse.
I will try to quit smoking lah. But I also don't want to smoke. Smoke so expensive. But you know, always very tired. Then smoking sometimes help me to have more energy lah. Yeah, okay lah. I see how lah. Try.
The hemodialysis procedure itself is pretty simple. Firstly, your blood will be removed from your body and run through the dialyzer. The dialyzer actually filters your blood and removes all the waste products. Your blood is then returned back to your body. So this basically fulfills the duty of your kidneys. There are unfortunately some complications for hemodialysis though. They can be seen in the diagram here. A common side effect actually is hypotension, which is a drop in your blood pressure.
I'm sorry.
So, Madam Honey, do you have any further questions?
No.
Okay. So, if you understand everything, actually we can head on for our dialysis session,
Okay.
and after that maybe you can proceed on to the discharge.
Yeah. Okay.
Alright? If there's any questions anywhere along the way, you can just ask any one of the nurses. Okay?
Thank you.
And thanks for your time.
Thank you.
Hi, Madam Honey.
Oh hi.
Hi. No, please sit back.
Oh,
How are
I'm
you
so
feeling?
dizzy.
Yeah, we're
Yeah.
reaching the end of your dialysis session already. And as I explained just now, one of the common side effects would actually be hypotension. It's a drop in your blood pressure. So that's why you'll actually feel a little giddy at this moment. Am I right?
Yeah. So what am I supposed to do?
Actually, what you can do for now is, you can just have a rest, and maybe we'll get you a drink as well. Just rest for a while, let your body recover lah. Then when you're feeling much better, then we can let you go back. Is there somebody who's coming to pick you up?
Not yet.
I would suggest you call somebody to pick you up so they can accompany you home. Anyway, just to remind you, you have to come for dialysis sessions 3 times a week, and each session will be about 4 to 5 hours, around how long the session took lah.
Oh.
You're aware of that, right?
Yeah.
Okay, is there any other questions you'd like to ask me?
Not at the moment.
Okay, I will go and speak to the doctor, and we'll have to see whether any of the medications have to be changed because you're on a hypertension medication, right?
Yeah.
And now your BP is already low, so actually I would suggest that you might not need to take the medication. I'll speak to the doctor and then we'll get back to you.
Okay.
Okay? Just take care for now, and once the session is over, just have a rest, please. Okay?
Although Madam Honey knows the importance of treating her illness, she did not turn up for the dialysis session as scheduled. She has to take up multiple jobs to support her family, and she cannot afford the medical bills. Even the dialysis center called her up to remind her of her treatment.
Hello. Yes, I'm Madam Honey. Oh, sorry, I have been working. Yeah. I will try to go down for dialysis tomorrow. Okay, sorry about it. Thank you. Bye. Hey, lady boss. I would like to ask for leave tomorrow.
Honey, again? Leave again? How many leaves do you want? You want leave again, is it? No, just leave lah. Don't apply for leave for me. Just leave.
She has been under tremendous stress both in her workplace and at home. Until one day,
I go lah. Can stop playing or not? Help me wash the dishes.
Yo, Mama, wait lah. I'm going to finish already.
Mama
You already, okay?
Mama today very tired.
Aiya, shh. Yo, Mama, go away. Oi! Oi, Mama! Oi, Zed! Hey, Mama! Mama, lie down already! Wake up.
Mama,
Mama, you okay not? Wake up, Mama. Hey?
Hello?
Mama, wake up.
Hello,
Wait.
Bye.
Hello?
Hello? Hi, good afternoon, Madam Honey. Yes, okay, I'm Dr. Lee from the emergency department. So I just got your blood test result. We found that there's a lot of toxic built up inside your blood. We probably will keep you under observation for a few hours before we decide to discharge you. We will send you for dialysis also. Yeah, because we need to clear out the toxic from your body before you are clear for discharge to go home. For the meantime, just rest for a while and we will see how's your condition going. Have you had any questions for me?
some time. I'll be back soon. Okay? Okay.
Nurse, must I go for the dialysis later?
Yes, we need you to go for the dialysis so that we can clear the toxins away from your body because you actually have a high amount of it inside you now.
I feel so tired. I'm tired of all this treatment and stuff.
Why are you so tired?
It's like dialysis and this whole kidney problem is taking up so much of my time. You see, I have two young children to take care of, and I'm the only person at home since my husband passed away already. I need to take care of them. I need to work. I need to do housework. But having to go for dialysis like 3 times a week and every time taking so long, it's like I don't have time. I need to earn money. And because I take so many leave, right, my employer is going to fire me. It's so hard for me to cope with all this.
Okay, you don't need to worry about all this, Madam Honey, because actually we have a lot of schemes that helps patients going for dialysis to meet the financial needs and also help their family relieve the stress and burden. So, Madam Honey, these are some organizations that can help you cope with your hemodialysis and also your renal failure. So, Madam Honey, we will perform a financial means testing to allow us to understand more about your financial background and to determine how much subsidy you're eligible for. This one is also known as means testing. So one of the organizations that supports kidney failure patients would include the National Kidney Foundation, also known as NKF. So they provide an affordable rate for hemodialysis to their subsidized patients. So like patients like yourself who need this subsidized fees have access to affordable medical screening and treatment as well as food support. So you just need to pay a small portion of the original treatment fee. Another organization is the Kidney Dialysis Foundation, also known as KDF. So they provide hemodialysis for patients that belong to the lowest 10% of the income group. So you will actually have access to subsidized medications and hemodialysis. So actually we can help you sign up for this scheme if you're interested in it. So you don't need to worry about paying too much for each dialysis session.
Okay, I will go and find out more. So I will need to go for my dialysis, right?
Yes, we'll be bringing you to the dialysis center soon. So you just take a short rest and we'll come back to you in a while.
Okay.
Do you have any other questions?
It's okay.
It's
Thank
okay?
you. I feel better after talking to you.
No problem. Thank you for sharing with me.
If you ever find yourself stuck in the middle of the sea, I'll sail the world to find you. If you ever
My help or not? Need Now you tired, just rest, okay?
Just came back from dialysis, so take a rest, okay? Anything, just call us. Okay.
find out what we're made of, when we are called to help our friends in need, you can count